The background of this call today is that Agenda for Change, since we began in 2015, we're interested in trying to show that system strengthening as an approach is actually leading to better results than the traditional approach of projectized, hardware focused, service delivery focused interventions. So we asked our colleagues, who I'll introduce in a second, to see if they could help us make that case. What they've done here and what they'll be talking about today is both the findings of what our members are measuring related to system strengthening, and also the second part will be where they're suggesting a phase 2 of what we can look at in terms of case studies and finding that evidence of do stronger systems lead to better service delivery. They're going to be much more articulate about this and give a lot more detail. But for now, I'd like to go ahead and introduce Kate Fogelberg. She is a consultant at the Springfield Center. Wave hi, Kate. It's a UK-based consulting firm that specializes in systems approaches to development, so not just WASH. Kate joined Springfield in 2015 after nearly a decade working for Water for People, where we were colleagues, in a variety of roles. She has lived and worked in over 30 countries in Latin America, Africa, and Asia. She's currently in the UK. Formerly trained in economic development and health, she now provides a wide range of strategy, training, and evaluation services to funders and implementing organizations interested in systems approaches. Harold Lockwood, say hi, Harold, our other consultant today, is the director of the UK consulting firm Aguaconsult, which is also a member of Agenda for Change. And he's an international expert in water supply and sanitation with over 28 years of experience focusing primarily on the rural subsector in areas including institutional reform, sector policy development, decentralization of governance functions, service delivery arrangements, and sustainability of services. He authored a book in 2011 on the sustainability of rural water service provision. And since 2014, he has become increasingly focused on systems-based approaches to sector strengthening and on reform processes. Welcome to Kate and Harold. Welcome to all of you who are joining us and please introduce yourselves in the chat box. Alec, do you have the Zoom functions? Let's just show those again as people are joining. Would you like to walk through these, Alec? Maybe unmute yourself.
Okay, I'm having some Zoom faux pas here. If you move your clicker up, you'll see the menu pop up, this little black menu on the bottom. So if I can get it to go back, the mute button is in the bottom left corner. This is on a desktop, by the way, for Zoom. We ask that you mute yourself as you come into the meeting, but during the discussion, if you'd like, you can unmute yourself. You can have your camera on and off. It's your choice. And the chat box you can use right here by clicking on this icon in the bottom of the screen. And then also just to note that the interpretation should show up on the bottom of your screen as a globe. When you came in, it might have lit up and told you that languages are available. So please pick English, French, or Spanish. That will greatly help us. If you are on mobile, the mute button is in the bottom left again. You can click the ellipses here and your chat function will pop up there in the upper section of your phone. I believe this is also where you can utilize the interpretation feature. Thanks.
Thanks. And if you are having problems, Alec can be helping monitor the chat box, and I will as well. Sometimes it's hard for us to see all of them. So hopefully you can all help each other since we're all Zoom experts probably by now. So now with that, I'd like to go ahead and introduce let our colleagues Kate and Harold present their findings from the phase 1 of what are Agenda for Change members monitoring.
Thanks very much, Susan and Alec. Just as by way of a bit of an introduction, and for full disclosure, as Susan mentioned, Aguaconsult is a member of Agenda for Change, that I was involved in this piece of work. But I would point out from the very beginning that Kate has done the vast majority of this work. So her great work should be recognized in all of this. And in fact, we weren't involved, as we didn't provide any data because we don't do measurement on, we don't implement on the ground. So just as a declaration of that potential conflict of interest. So what are we going to run through in the next hour or so, and providing some time for you all to give your inputs and feedback and ask questions. It's divided into two sort of blocks, if you like, as Susan mentioned. In the first round, we're going to talk about the assessment, what we looked at, what was the background to that, the information that we're looking at, and the process of how we looked at the members that are measuring system strengthening. And then we're going to focus down on what members are actually measuring. So what are the things that Agenda for Change members are actually looking at that are linked to or relevant for system strengthening? And already Susan has mentioned the building blocks, but there are other aspects around member behaviors, around coordination and so on that we also wanted to find out about if and how people are measuring. So we're looking at what they're measuring and then indeed the how. So how they're doing this, how frequently, where is information stored, how is it being used and accessed and so on. And then we'll close this first phase presentation with a few reflections of sort of what does it all mean, kind of reflections around what we found. And Kate will summarize that. Then we'll have a little break for question and answers. And then move on to a bit of a forward-looking section of today's program, which is introducing some ideas about what could possibly be done to look at this link between our work as a membership of organizations to try and strengthen WASH systems at different levels, and how and whether that work of strengthening systems actually leads to more to better outcomes in terms of service levels and service delivery. And that's a little bit the holy grail. I don't know how you translate that, but that's the sort of the link we're trying to show. I don't think we all, I think, are realistic enough to see that we won't have a direct causal link to that. It's going to be very hard to actually sort of measure that precisely and prove it in any way, but we can try and look at the kind of work we're doing around system strengthening and whether that leads to better outcomes. And stepping back a few paces, that was the original ask that Agenda for Change had, the Secretariat. Could we look at this? Could we find this link? And we had a bit of back and forth in the design of this piece of work and said, well, let's first concentrate on what's the sort of status now? What are members collecting currently? And only then can we be in a position to say whether or not it's likely we can look at this relationship between system strengthening and improved outcomes in terms of service levels. So next slide, please, Alec. So the background to this whole assignment, before we sort of jump into the results. And again, just as a reminder, the objective was to landscape what was being collected by members now, and to understand what you all as members are collecting, the factors, the sub-factors, looking at indicators and so on, and the frequency. So first we developed a framework, which we actually shared with you all. And this was based on the original or the existing building blocks of Agenda for Change, which we've called factors in this presentation, but also including sub-indicators as well, as the factor categories are quite broad, and we deliberately allowed this framework to be adaptable. So if there were things that weren't already in the framework, we asked you as members to add them in to be able to capture a broader range of areas that you were looking at. Then we asked you to fill in this framework, and we think that's a very important part of the process. So it's not just us coming along and kind of extracting the information. And that included an introductory call, some follow-up back and forth by email. And I think we've reflected as a team that part of this whole process and the value of this process has been to get you all as members to think about, reflect, look at, and really reflect on what you are actually doing now. Because in the hurly-burly of day-to-day work, sometimes there isn't the time for that reflection. So I think we had some feedback, and Kate can pick up on this when she presents the findings, that you found this quite a useful exercise in and of itself. So we're glad for that. And then the third step in this process was we looked at the information we collected and tried to make sense of it, and consolidated it in both qualitative and quantitative forms. And the good news is we had every member participated. And we should just say in a polite way, with differing degrees of enthusiasm, but we got information from all of you. So thank you very much for your time on this. And yeah, that's the sort of background to this whole assignment, which will present the results now. So Kate, as I said, has done the bulk of the work on this, so she's now going to walk us through the findings. So as long as the interpreters are happy, we'll keep on at this pace. Alec or Susan, give us an indication if we're going too fast. But Kate, it's over to you. In the next slide, please, Alec.
Thanks, Harold. Hi, everybody. Apologies, my camera seems to be malfunctioning, so you'll just have to hear me and not see me today. But picking up where Harold left off, we've got a couple of slides that will look at what our members measuring before we dig into how is that being done. And firstly, at this factor level, so as Harold said, factors is really the terminology we use to describe the building blocks plus. Members reported that they are measuring a total of 14 factors. So that's each of the, if you're looking at this graph and trying to interpret it, that's each of the words up there. About 75% of you reported measuring 9 factors. So kind of the ones that you see further out, those are the ones that most of the members are measuring. Those correlated quite neatly to some of the main key building blocks that are used by Agenda for Change, or some of the individual members themselves. We had the additional factor of learning and adaptation was measured by less than half of members. 3 more members reported measuring relationship between actors, and 3 factors were reported to be measured by only 1 member each. And I think if we kind of zoom out and look across the members and across the factors, it's pretty clear that there's quite a lot of synergy in members measuring some of these key building blocks of system strengthening. There was less synergy around some of the less tangible factors, so some of these around learning and adaptation, relationships, etc. I think I'll leave it there and we can get on to the sub-factors. So next slide, please. As Harold mentioned, we allowed for members and quite asked them to be more specific. Factors are quite general, and I think when you start thinking about implementation and measurement, the use of sub-factors or more specific descriptions of what you're actually talking about when you say policy and institutional mandates or finance is helpful. So of those 14 factors that members were measuring, they reported on a total of 90 sub-factors. And while we saw quite a lot of similarity at the factor level, that 75% of members measuring across 9 of them, at the sub-factor level, we saw a lot more diversity. So for example, when we looked at a simple majority, so just what were more than half of members measuring, that knocked down the 14 number of factors down to 10 factors. And similarly, it knocked the 90 sub-factors down to the 28 that are listed on this slide. I would say this is somewhat to be expected, as the factor categories are quite broad. And members need the flexibility to measure according to what makes sense in their context. But even with those caveats, it was interesting to see that a couple of these factors, the 3 with the arrows, sorry, I'm touching the screen like I can move it, but the policy, institutional mandates, planning, and WASH-related social norms, we did see quite a lot of synergy there. So for those 3 factors, more than half of the members were measuring more than half of the sub-factors. So I think we can say across the membership, there appears to be quite a lot of synergy in what's being measured, even at a sub-factor level, along policy and institutional mandates, planning, and WASH-related social norms. For the other ones, we saw much more diversity. And if we just looked at finance, for example, you can see that members reported 11 different subfactors. So that might be specifying between public sector investment, private sector investment, tariffs, life cycle costing, lots of different ways to kind of break up and operationalize finance. But across the membership, only 2 of those were being measured by more than half, and that was the public sector investment and life cycle costing analysis. So again, kind of at the membership level, much more diversity at the sub-factor level, with the exception of policy, institutional mandates, planning, and WASH-related social norms, where we did see more than half of members measuring similar things. Next slide, please, Alex. And lastly, on kind of getting into the nitty-gritty, how were members actually measuring these sub-factors? We asked folks to report back what indicators they were using. Across the 14 factors, we got a total of 532 indicators reported. Interestingly, as you can see from the graph, sorry, the axis there on the left side is just number of indicators. So this is showing the number of indicators that are measured per factor. That first factor, policy and institutional mandates, had 105 indicators, I believe. So quite significantly, that is the factor in which most members are directing their measurement efforts. I know that one alone accounts for all of the last 6. So if you look at political and financial commitment, partnership, collaboration, etc., the policy institutional mandate is more than the sum of the least 6 measured factors. So on quantitative, that's kind of our high-level quantitative analysis. We did a rapid qualification of indicators using kind of a partial SMART analysis. So for those of you who are familiar with SMART indicators, we just looked at whether or not indicators met the S, M, and R. So were they specific, measurable, and relevant? And yeah, the vast majority were across the 12 member organizations who reported. Indicators were clearly defined, they were specific, they were relevant. I think the more interesting finding at this level was just the differences in how members articulated those indicators. And what I mean there is, were they just describing kind of a factor that had changed, or were they specific enough about wanting to measure how one of the permanent actors in the system, so a service authority or a service provider, were performing that factor or not? I'll give you an example. So with life cycle costing analysis, which quite a lot of members were measuring, some members almost measured their own ability to do that. So they were saying, right, we conduct life cycle costing analysis. That is kind of an activity indicator for ourselves, whereas others were more nuanced in their indicator development along the lines of, you know, the district authority or the service authority as a plan that used life cycle costing analysis in it. And we can pick up on that sort of dynamic later in the discussion if you guys are keen. Next slide, please. So that's a really high level overview of the factors, sub-factors, and indicators. I should mention that in the report, it goes into much more detail at that factor level. There's an annex with all of the sub-factors and how many indicators are being measured. So if you want to get into the detail, I suggest to the annex there. But moving on in the interest of time to just some of the high-level findings on how people who measured, how people were measuring. Firstly, we asked folks to describe the level of their measurement. And by level, we were looking at, are you measuring at a national level? Are you measuring at a local level? Is this household information? SP is service provider or other. So you can tell even just from a quick look at this graph that dark purple seems to dominate. Dark purple is the local level. So what this graph is showing is that, you know, arguably most of the measurement is happening at a local level across the membership. There's the bit at national, which is the gray but really 3 organizations, 3 of the 12 reported any kind of significant national level measurement, which I think is an interesting finding for Agenda for Change. And then the others, service provider, household, and other followed suit. Next slide, please. We also looked at the frequency of their measurement. And on frequency, we were looking at kind of most critically, are folks collecting baseline system information? Just remembering back to the task at hand, what Agenda for Change was interested in exploring was that link between system strengthening and improved service delivery. So in order to even start to think about exploring those links, we needed to see if there was baseline, both service delivery indicators, but also system indicators. And what this graph shows, again, with the purple, is that there is, definitely more than half are reporting baseline system information collection. And we also see, just kind of good practice of implementation and end-line collection as well. Let's go on. Next slide, please. And the last summary slide on how was really looking at the data availability aspect of this. This served 2 purposes, both one, to reflect back on what currently exists, but also to feed into whether or not a second phase could even be feasible. And as you can see from the graph, there's a pretty even split between those members at the beginning of their system measurement process, so those that have 1 year of data available, 5, almost half of the membership, and those who have 3 or more years of data available. So we have another 5 that reported that, and a couple who didn't respond on that. As Harold mentioned too, all members expressed an enthusiasm and a willingness to share data. I think the caveats to that are that sometimes even within an institution, it can be difficult to access that data, whether or not because that's being held in a specific project or a different department of the organization. And that there may be some issues with getting specific donor permission to be able to share all of the project-related data. Next slide, please, Alec. Well, so what? So what did all of this show us? As Harold and I have both been alluding to over the first 15 minutes or so, there is evidence of kind of good measurement practice to build upon across the members. Whilst we weren't sort of formally benchmarking practices, we did find evidence of baseline systems assessment, which is an important indicator. There were, with systems programs, it's often not a binary process, right? You don't go from a weak system to a strong system in one fell swoop. There's often intermediary outcomes, step changes that happen. And we saw quite a few organizations building that into their measurement systems. So again, this indication of intermediate outcomes, or you're going from red to orange along a color-coded assessment of any factor is good. And as I said, relatively clear indicators. So across whether or not you're measuring your own contribution to improving a factor or your contribution towards a permanent actor's performance of that factor, indicators were relatively clearly developed. All good. Secondly, there appears to be real enthusiasm and interest in learning and improving. It's always interesting as a consultant when you send things out or ask people to fill things in. I think sometimes you would like it to be as useful as, and I think Harold and I were pleased to have some really positive feedback from some members that this exercise in and of itself was really useful for members to think back on what is it that they're measuring, how are they measuring it, how could they learn from others measuring it. We asked members to do a quick mini sort of self-assessment, self-satisfaction exercise, and the vast majority came back somewhat satisfied. So we asked people to rank their factors as not satisfied, somewhat satisfied, or very satisfied. And as a general finding, most were somewhat satisfied. I think the caveat to that was that some folks felt it was too soon in their institutional journey to be trying to explore these links. And I think that's a fair point. If you think back to the graph on data availability, that 5 organizations have got a year of data. Some of the other feedback was that it's too hard. It's too hard to measure some of these less empirical things. So shifting from, you know, counting taps and toilets to service delivery metrics down to system factors and relationships, that level of measurement is new and difficult for some members. And lastly, that in some contexts, the institutional structures in which systems measurement sits are just too rigid. So to be able to adapt a measurement process to a WASH system strengthening program in some large institutions was challenging. And a few of the specific factors that members, so in addition to kind of the process, their reflections on what was difficult about the process, I think what was difficult about the content, a couple of factors stood out. Finance was one of those factors where multiple members just commented on the challenging aspect of measuring finance. And one of the issues there was around having access to financial data, and just that no WASH finance data isn't often kept in one single place by one single actor. The other one, which as an outsider to Agenda for Change, I found really interesting, was just this challenge around how do you measure coordination and collaboration? And I think that that's something for Agenda for Change and members to further reflect upon if it's something that is so important to the community of practice, to be thinking through how, as a group, you could collectively be measuring that better might be an area of future learning. And the last one was on monitoring. So it was interesting to see a couple of comments just around this tension of who should be monitoring and why, and what that refers to is, you know, should, almost a more normative judgment of should implementers, should NGOs be doing, you know, service delivery monitoring themselves, or should they be supporting local authorities and local systems to use whatever monitoring system exists. Yeah, as Alex put up, so the next finding is around just what did we find in terms of assessments, and I think lots of good examples of descriptive assessments across the membership. And when I say descriptive assessments, I mean kind of just describing in what state the factors are. So that's a lot of kind of multi-factor color-coded checklists where you can refer to, you know, in 2015 when we started, the finance situation was kind of intermediary at an orange level, and after you've worked there for a few years, you'd like to see it move up to green level. I think we found less examples of exploring why things are the way they are, either at baseline or at later phases of implementation. So trying to explore why things are changing or not changing. And that would be at both the system level and at the service delivery level. That is arguably harder to do than to count some of the more common WASH metrics at service delivery level. But interestingly, a couple of members did mention ways in which they were trying to do that, whether that was through kind of ongoing outcome harvesting processes built into their measurement systems themselves, or more robust one-off assessments into outcome harvesting, to, again, sort of internal reflections of an organization's value add in a given district. Can you advance, please, Alec? This one, not just a technical challenge. So this refers to the fact that we use the word will and skill a lot in my line of work, but that I think with measurement and system strengthening in general, there's a correct assumption that a lot of the challenges are technical. It is harder to measure these things. But some of the members, when we spoke and followed up, also described what I would call an incentive challenge. So that not only is there maybe a component of I don't know how to do this, but I don't have a reason to do this. So even though I might want to, either my donor on this project isn't explicitly interested in systems changes, they're much more interested in service delivery metrics. So that's what we're invested in counting, or I don't have an internal agenda around learning about what's working. And I think what's important here is that moving forward, for members to reflect on, I guess, just the balance of that within your institution, because if you are facing an incentive problem, addressing that with a technical solution, so a toolkit or TA, it might not be the solution to the problem that you're currently facing. And then lastly, please click, Alec. Just adding it all up. So remembering, how this all started, Agenda for Change, being interested in looking at the evidence base between those two levels of a theory of change, right? That a stronger system would lead to improved service levels. What we found was quite, I would say across the membership, a decent evidence base of both of those two things. So we found quite a lot of descriptions of system changes and ways to measure those. And similarly with service levels, what we didn't see many explicit examples of were organizations themselves interrogating those links and trying to explain how a system change was or was not leading to a service delivery outcome. I'm going to leave it there and open it up for questions before we move on to the second phase.
Yeah, thanks, Kate and Harold. A lot to go through there. We have, as a reminder, there is a report where they go into this in more detail beyond the chart, so don't feel like you have to frantically write everything down. It's a very nice report, very interesting. So we have a few minutes for questions before we go into the phase 2 part. It looks like there is one from Tony. Would you like to unmute yourself, Tony, and ask, or would you like me to?
Oh, sure. Thanks, Susan. Thanks, Kate and Harold. This was really interesting, and thank you for the overview. If my mic. No, I was wondering, Kate, you mentioned the incentive issue in terms of donors requiring more service delivery indicators and not system indicators. And I was just wondering if, as part of the review, you looked at which, if any, system-related indicators are required by donors and which donors, partly because of that incentive issue, but also as we think about advocating with donors to put greater emphasis on system change. A part of that would, definitely need to be what we're measuring and what donors are asking partners to measure. Thanks.
Yeah, I mean, the short answer, thanks, Tony. The short answer is no, and I think that's an important qualification or just reminder to the report, is that the scope really was limited to the implementers themselves. So while we did hear some challenges with donors, we didn't get to get the donor perspective on this. I don't know if, Harold, you want to add anything to that point?
Yeah, I think from a methodological point of view, the answer is no. We didn't, as Kate said, find out about donors, but we know, and I think it's important to recognize that there are some donors that work with many of the members who are interested in systems change, and increasingly we know that donors are starting to see the value of investing in this sort of systems type approaches, and that it's coming out more and more in policy. DFID is mentioning it. USAID is recognizing it, and I would say it's important also to recognize that donors are not monolithic. So you'll have some parts of a donor, for example, USAID, where they're actually very progressive and are doing a lot of work in investing in trying to understand systems in general, trying to understand how you strengthen them and how you measure that change in strength. So we know USAID is putting in some $14 million into this learning program called SWS, Sustainable Wash Systems Learning Partnership. That doesn't mean that the run-of-the-mill, random USAID office in a country mission, the officer in charge doesn't care anything about systems or doesn't even, understand it. So I think you have to be a little bit careful when you say donors and treat them as just one big block. So I think it's that's part of an evolving process, but the trend is, I would say, greater interest on the part of donors, but we're a long way off from that being a very common interest across the board.
Thanks, that's helpful. Just one quick follow-up. Those of us that are measuring some system change indicators, do we have a sense of what proportion of those we're just doing for ourselves versus that we are reporting to donors? I don't know whether that was part of the study.
No, that's a good question, Tony. I think the only reflection I can offer was that, and we didn't put this slide up, but the membership of Agenda for Change is quite, we think like, oh, everybody's working on WASH, they're all quite the same, but the institutional setups are really different. So you've got organizations who follow kind of a similar approach in one country, only working on WASH, to organizations like DRS, where you are, that are multi-sector, multi-country. And there was one large organization that had there were two actually, a couple of kind of KPIs that you could interpret as system level indicators that they measured across their portfolio, right? And irrespective of who the donor was. But those were limited to 1 or 2 KPIs per large organization, really around, I think, an impact of policy change. I have to go back to my notes and see, but I think there were 2 large organizations that had included a couple of KPIs in their institutional measurement, as opposed to a project-specific kind of donor, for one specific donor.
Can I add also, Susan? Sorry, I know time is, we have to look at the clock, but sorry, something polls just popped up.
You can still speak, Carol, but we wanted to give people a chance to answer this.
My brain doesn't move that fast, Susan. I see a box in front of it. I think your question raises an interesting point. I would link it to something that Vinny wrote in the chat box about reflecting on why change happens, and that this is not always reflected in formal monitoring, centralized monitoring systems. That a lot of it is between the formal points, if you like, in workshops, reports, and so on. And I wonder, this whole effort we could ask ourselves a sort of a rhetorical question as Agenda for Change members: do we want to start trying to contribute to a common monitoring platform with a core set of indicators which would build some kind of consistent, coherent evidence over time? So that's one of the spin-offs, I think, that could be interesting for discussion, is that now we've gone through this process, how difficult would it be to try and set up a way of reporting that actually starts to capture this at a scale across these different contexts?
Great. So thanks both. Thanks for those of you that filled out the poll. We had about 50%, I think, of the attendees. Just get a sense of these, whether these findings seem accurate. Nobody said no, so that's a good sign, Harold and Kate. It looks like, let's see, there was a question from Savatha that I think will be answered in phase 2 about who is actually doing things. Fraser had one about looking between the links between systems and service improvements. I think that's going to be also answered in phase 2. And then Bruce had one about, are there members who are supporting national monitoring systems in the country where they're intervening? And if yes, are there lessons and challenges? Maybe that would be one you guys could answer, Kate.
I don't think we probably can give you a very satisfactory answer, Bruce. Part of that is just the level of analysis at which we did. So I am remembering that if 1 or 2 members mentioned that they were measuring, and this is interesting with monitoring, right? So their monitoring indicator wasn't around, themselves doing monitoring, but it was, were all of the districts in their area using the monitoring system, or was there cross sector use of so there are a couple. I'm not giving you a very satisfactory answer, but it wasn't widespread, and we didn't really get into the mechanics of how folks were supporting that use of national monitoring systems. It was much more around what are members measuring regarding monitoring. And one, I want to say 2 come to mind, mentioned explicitly that one of their indicators of success was the use of national monitoring systems. Sorry,
And
I think that's unsatisfactory, but that's all I've got.
Well, I think it's an important distinction that you're making, Kate, because if you took a purist approach to this, you would say that as Agenda for Change, we believe it's not up to us to monitor what we're doing. We should be monitoring the ability and the capacity and the sustainability of permanent national entities to do that monitoring, right? So it's an important distinction. And I think we found a couple of those, but we weren't really looking at that as the get out of jail answer to your question. But it's a good point.
Yeah, and I think it's just that is a good it's a good example of just this larger reflection of I guess members either mandates or visions, or getting into what is it that they're trying to leave behind, and whether it's not them performing a monitoring or training or whatever function or factor it is, or that permanent actor, whether that's a national monitoring system or a local government technician or a water system operator.
Thanks. I'm going to take one more. I know there's lots and lots of questions here, and there is a report, so hopefully some of those are answered in there. And I think maybe we can ask Kate and Harold if there's some that aren't answered in there. Maybe we can get some answers from them after this. We do have. We really want to spend some time on the phase 2 discussion about what we want to measure next. So we don't want to take too much time with the Q&A here, but I'll take this one more that's from Fraser Goff about, did any members use measurement approaches that transcend the building blocks? So things like organizational network analysis or causal loop diagrams, how would those be considered in your inventory?
Thanks, Fraser. Yeah, a couple of organizations mentioned, I guess, non-building block approaches to this. The tools that stood out were an ONA, organizational network analysis, that Watershed, I believe, did. Quite a lot of, when people were looking at, we had a question of, do you do sort of any system level assessment, right? So not just looking at building blocks. The most common system level assessment, I would say, is still a kind of multi-building block assessment. However, we did see a couple of examples of outcome harvesting or outcome mapping. That would probably be the more common tool we saw.
I think examples of those are in the report or in the annex, the data framework, which we can also share.
Yeah.
Data framework, but we did look at that. There were some examples.
Great, thanks so much. Now let's get into the part that I think a lot of people have questions about. I think many of the questions that they're answering will be things that we can discuss about the phase 2 research. So Alec, if you have the next slides there. I don't know, Kate or Harold, who's going to present this part. This is where we asked Kate and Harold to come up with a potential scope of work for what we would do next. So take it away.
Thanks, Susan, and thanks everybody for your questions. I'm sorry we couldn't answer them all, and hopefully this next section will allow us to answer at least a few more of them. Just a reminder, a health and safety warning about what it is that we were tasked to do under phase 2. Really just develop a framework on how we could analyze if WASH system changes are contributing to improved service levels. So I just want to point out that we're not at kind of a full research proposal phase of that. It's really the higher level framework proposition at this point. And linked to the results from phase 1, we were also asked to propose a sampling framework or sampling process for a subset of members to try this out with in phase 2 if there was interest in taking that forward. Given the time limitations, we're going to focus on that first deliverable for the 10 minutes or so, 10, 20 minutes we have here, and not really get into how or where would we do this if we were to take it forward. So I'm just going to give a brief background as to why we are proposing the framework that we are before getting into that. Next slide. Thanks, Alex. So just briefly, the framework that we are proposing has a conceptual underpinning in theory-based evaluation. So I don't really want to get into the technical weeds here, but just to give so we're all on the same page. From the first phase, it didn't appear to be immediately feasible to to some of the more perhaps quantitative analysis to statistically determine causality between different inputs and outputs and outcomes, or to determine kind of a statistically significant answer, yes or no, does system strengthening lead to improved service delivers? We would need kind of control groups, a reliable counterfactual, etc. However, luckily, theory-based evaluations are a recognized evaluative approach to these kinds of contexts. As Harold said in the beginning, they don't set out to prove or disprove something, but rather make a plausible case for how a member's activity has contributed to an output, i.e. system strengthening, and then to an outcome, improved service delivery. A researcher describes it as a process similar to building a case in a court of law, which I think is more tangible for people to get their heads around it. So in a court of law, you're kind of bringing in different evidence bases to try and convince a jury. So whether that jury is your internal organization, your peers through agenda for change, or your donor, that something had a reasonable chance of happening. I think the other reason for selecting an approach with this kind of underpinning is that most members have either a very explicit or implicit theory of change, suggesting that this type of approach could be feasible. Can you hit next, please, Alec? Just, yeah, if you are interested in getting into oh, sorry, no, go back, just, I didn't realize you'd be driving when I did this. Yes, so at that first level, if you're interested in more kind of wonky evaluation details, I'd suggest Better Evaluation has a really good user-friendly approach to a lot of tools. But secondly, and as an ex-implementer, what we're proposing is pragmatic, it's practical, this isn't something that Harold and I sat around on our respective Zooms coming up with. It really is pragmatic. It's based on a similar approach that institutions are using to measure system changes themselves and or as a framework for external review. I mean, interestingly, this DCED is the Donor Committee for Enterprise Development. As its name says, it's a donor community of practice, and they were really instrumental, donors were really instrumental in setting up this approach to measurement. And if you want to see how that's been working in practice, the Beam Exchange manages an evidence map where they post all sorts of examples of evaluations, internal, external, that have used this type of approach to understanding the links between system change and that next level of outcomes. And lastly, it appears to be feasible. So part of the first phase, as I've mentioned, was exploring whether or not a second phase would be feasible. I think some of the positive indicators there that it is this stated member interest in wanting to learn more, to do more in this area. Importantly, from a technical point of view, there does appear to be at least several examples where there is baseline system and service delivery measurement, as well as updated, a couple of organizations do have several years of system and service delivery data available. It's the caveat there is this first phase did not dig into that data ourselves. So Harold and I didn't really review system or service delivery data. We were relying on what people told us. So the next phase would look at the data itself. Next slide, please, Alex. A different way to think about this is, the framework has a conceptual underpinning. It's been pragmatically applied. We think it's feasible, but it also aims for what I like to call the Goldilocks of measurement. So it's not too much or too little. And two cartoons illustrate this better than my words. On the left, we've got a couple of scientists, frantically staring at, then a miracle appears. So between an action and a reaction, something happens. But it's too complicated to understand what that might be. Kind of the hopeless pessimist approach to measurement. And on the right side, we've got the fantasy model of direct impact, which is, our thing, our intervention, our activity is the thing that changes everything and ends water poverty in this case. So what we're hoping to find is something that balances between these hopeless pessimists and these misguided optimists. Next slide, please. So what we've landed on is an assessment framework approach that is based along a theory of change. So I keep trying to point at this, but essentially, if you are familiar with theories of change, they simply try to link an activity. So that's that first left side column, agenda for change member activities, to some sort of output. In this case, that would be the wash system change or changes we're working on, which would then lead to a service delivery change in performance, and then impact, right? Somebody's going to be benefiting from this. At each of these phases, we would have different, this is indicative, some of the indicative questions we'd be asking. I think the interesting one that is unique to, at least for me, and the work when I've done this to Agenda for Change, is that second question there around kind of how collaborative were these activities with Agenda for Change members. I have an imperfect and dangerous amount of knowledge that there's another study going on looking at collaboration, so there may be some inputs or crossover there. But essentially, we want to look at both what did individual members do if they weren't collaborating, but in the event they were collaborating, try to understand that a bit better. And then look at that next level along the theory of change. This is broad enough that you could apply it to whatever factor or relationship you're working on in, a rural context, an urban context, in a water system, a sanitation system, a hygiene system. And I think what a lot of the current measurement does really well is it answers that first question. So kind of what's changed in the variety of ways that members are using. I think we found less explicit documentation of exploration of why they might have changed, whether that was a contribution from a member or a collaborative effort of members or something else. So we would encourage this next phase to be a bit more rigorous at looking at what else may have caused those changes over the time frame. Similarly, a similar line of questioning at service delivery. So again, using those at least 2 different points in time of your service delivery metrics to see what has changed, and interrogating a bit deeper, why has it changed and what caused those factors. And lastly, again, this is important to understand who's benefiting and how. We're not suggesting doing health impact or other impact at that level, but really relying on what members may be conscious of time. So I think I'm going to leave it there and open it back up for questions.
Yeah, thanks, Kate. Before you do that, we're going to have another quick poll. And I know that people will want more options than this, but it's just a temperature check, if you will. So it's what would be the most useful focus for further research? And we're going to have a discussion, but we just wanted to see sort of where people are right now. So if you want to go ahead and answer that poll, and then we'll start getting into the discussion. And thanks, Kate, for giving the background on this and the possible framing. And again, there is a scoping report that we shared with the invitation to this webinar. So you want to see more detail on that, you can also find that. Let's give a few more minutes for this because there's a lot. If you have an other answer, please do write it in the chat. And you just want to get a sense of where people are feeling. Yeah, I think some people are going to say everything. We want to measure everything. So we've got a little bit over a minute left. If you do have comments or questions you'd like to put in the chat box so we can start this discussion, but we'll also do kind of a more open. Let's see, we've got about 67% people voting here. All right, give it a few more seconds. Last chance to vote. Okay, thanks. And Alec, can you share the results? Great. Can I capture that screen? Okay, great. So let's open it up. Sorry, Harold, were you going to add something to what Kate said before we launch the poll?
A brief, just to sort of bring this back down to earth. And be pragmatic or practical. I think, this was the original ask of the steering committee in this terms of reference that you originally sent out in, I think it was June this year, was, trying to look at this relationship and could we indicate or could we show what the linkages would be. And I think at that point we said, well, hold on, we don't know, what people are actually already looking at and if there's enough data out there. And this comes back again to this phase 2, I think, and Kate, please correct me, but I think we found, or we think that there's only 3 or 4 examples where we see enough evidence of data and information on a baseline, an end line for looking at both system strengthening and change in the strength of a system over time and the service delivery element. So I think we've got to be a bit careful about saying, we couldn't do this for all members all over the place. This needs to be focused where you have a chance of succeeding. Otherwise, you're just going to look at stuff in detail and say, well, we can't show it. We can't find any kind of linkage between the two because we don't have enough data. That would be the main thing I would add. And just to pick up on a note that Vinny raised around externalities, I think that's a very important part of this assessment, that somehow, as well as looking at the work of the membership in the specific areas of intervention, of course, there can be broader external factors, processes, whether those are economic, whether they're health, as we've just seen with COVID, they can have a big influence. So we'd have to account for those as well.
Great, thanks. See, one comment in here was in the chat is that in your first box that so this is an interesting point of discussion for all of us, is what are the boundaries of what we look at, because you've got Agenda for Change member activities, which is, sort of what we have control over in terms of trying to access data and talk to members. But then they've got, I think maybe the question is about the second bullet in that first box, which is how collaborative were the activities with other Agenda for Change members. Thoughts on that? Harold or Kate, in terms of, or other people, in terms of how we might frame that?
I would just add, just from our the discussions Harold and I had around this, I think there's sort of 2 levels of collaboration, if you can think about it. I think that first point around what activities members do with which system partners, so that was really trying to understand, what did IRC or what did WaterAid do with the local government? Did they provide technical assistance to help them create a WASH plan? That level of partnership. And I think that second question was more directed at Agenda for Change as a kind of collaborative effort is unique, in that they're really trying to encourage their implementing members to work together, on the ground in these districts. So this was a recognition of trying to bring that into the assessment. But I'm not sure, Harold, if you want to add anything on our thinking around that point.
No, I think it speaks to the comment by between John Butterworth and Lewis, that we should also look, and it's in there, it's in that first box, if you look at it there, is how do we look at what's being done jointly, which in theory is what Agenda for Change is all about. So I think looking at that collaboration would be very much part of the phase 2.
Right, but it's not, I guess what I think Hannah was trying to say, and I'm having a little trouble following both the discussion and what's in the chat box, but tough, not a great multitasker, but I think it's important that it's not just about collective action among the Agenda for Change members, it's collective action among all the key players in the system. And I think we need to get away from just saying it's about what the Agenda for Change members are doing.
Yeah, good point, Lewis. I think that's an important one to add to that first. And that first box to cover.
But Harold, I think what's underlying some of this is this emerging theory of change that in order to have effective systems change, there has to be effective collective action. And so I think that's what's underlying some of this, is whether there's a common agreement on that. And if so, then very important to be able to assess the extent to which collective action is working. If there's not common agreement on that, then then maybe we need a different theory.
It's Eric here from Wartrade. May I just pop in because I need to jump off onto another call rather urgently. I think what we often struggle with, and particularly this happens in networks and collaborations, is the separation of what you might want to measure around the performance of the collaboration or the collective effort, what you might want to gather evidence of to prove that your theory of change has validity, and that may not be done through monitoring. It might be done through other assessments and things. What the members might need to be able to measure their own contribution to that. And then particularly where you're trying to affect systems change, what measurement systems need to be in place within those actors that you're trying to support. And I think so, it's really difficult to separate all those different layers. But I think it's important we try create some sort of a distinction across all those layers to figure out what's the most appropriate for which part of the continuum, for want of a better word. And apologies, I need to drop off.
Thanks, Eric, for joining us. I think, yeah, if people want to jump in and unmute, as long as it doesn't get too crazy with too many people talking, go ahead. This discussion time. If other people have comments. Sabatha, I think you had one about who. Oh yeah, and Kate and Harold, you did in your phase 2 scoping suggest a few institutions and programs that this framework might work on. Do you want to talk about those? Maybe for discussion, because I think a few people had questions about who is actually doing anything that we could measure right now.
Sure, yeah, we can. We came up with a pretty simple sampling process, and the key one, as I've already mentioned, was just, at least, I think it was at least 3 years of data, of systems and service delivery data. And there were 1, 2, 3 institutions. Water for People had data at both those points. I should look at my notes before IRC, I believe, and Watershed. It's in the phase 2 report as kind of institutions who reported to have enough data. And then there were 2 specific projects of larger organizations.
Rana Wash, I believe.
Rana Wash, yeah, Rana Wash, which is a consortium of CRS Care and WaterAid and the CRS Azure project in Latin America. So those 3 institutions and 2 projects appeared to have, at least at face value, surface value, the minimum data requirements, I would say, to be able to do some sort of exploration of those links between the 2 links in the theory of change. But that's not to say, I think one of the interesting reflections that I had myself working on this was that, and ideally, measuring systems change and adjusting and reporting, that would all be kind of within an institution, right? And I think it might sound funny as a consultant saying you shouldn't have to hire an external consultant to do this, but that's true, right? I think the goal would be that an institution has both the will and the skill, they have the incentive and the capacity to measure what they want to know. And I think, again, just linking back to the conversation we're just starting to have, what is Agenda for Change's kind of priority that it wants to look into moving forward? It sounds like there probably is still some discussion in that space that needs to be had. But then, the goal would be that, the members themselves could do this type of analysis, that you wouldn't necessarily need. You could bring someone in if you wanted some external validity or kind of, a sparring partner or someone to spark debate. But I think, to me, the goal is that institutions themselves would be able to modify slightly some of the really good practices they're doing to be able to do this a bit more.
Yeah, it's interesting. I think in the comments and in your research as well, I think there's this tension between we want a common framework and there's no way you could apply a common framework. So I think, I keep seeing, can we measure things together, but there's no possible way to measure things the same way. So, I mean, what would you say towards that? Is that what this framework is trying to address here that you've suggested?
I mean, that's an interesting question. And I think other sectors, so that beam exchange that I linked to in one of the other slides is a community of practice of folks working on systems changes in lots of different sectors. It is probably more kind of economic, but there are, basic services. There's examples of housing, water, sanitation, how they've gone about, I would say, aggregating information and evidence is almost along this. So they've got an evidence map that maps out the wide variety of outputs that are produced and looks at, it aggregates evidence at the system level. It doesn't aggregate evidence necessarily on a specific factor. I think they do have a few, but the more important thing, I think, is along that theory of change. So looking at, okay, we've got kind of maybe there's 12 reports that describe the activities, the collaborations that people are doing. And then we've got, easily half have good information on some of the wash system changes, half on service delivery. So you can start to aggregate along the theory of change and that level of evidence, as opposed to trying to, the feasibility, I think, again, of just changing institutional measurement processes and frameworks is quite a massive task. So trying to, and it's not just a technical one as well. Again, that gets back to, I think, the institutional willingness and ability to match a measurement system that 12 other organizations want to do as well. But I think the evidence map, Susan, is something maybe to look into. I'm not sure that Agenda for Change, I'm not sure there's enough evidence out there right now, but it might be something to think in the short term of a way to compile and aggregate the evidence that is getting produced.
Sabatha, I know you had a question earlier. You had a couple questions and I can't find them because they're way back. A lot of good discussion in the chat box. Would you like to jump on and did your questions get answered or did you have more?
Thank you. Sorry, I'm getting a bit disturbing. My kid is having her class next to me. Actually, my question refer to some argument that we've been saying of having system strengthening project versus the service delivery. And I'm not sure whether any organization within Agenda for Change member has already had a very great monitoring system or monitoring framework, showing or proving that it actually make that change. And that's it, service delivery did make a very great like improvement. I just like to hear and if we can share that monitoring framework. Thank you.
No, Sabatha, sadly, I think the short answer is no. I think that's what the second phase would try to do. I think there's a lot of good ingredients. There's a lot of data around there on systems and how systems are changing. And there's data on service levels and how service levels are going up and or down or becoming more equitable. But there was less evidence of organizations themselves trying to explore the links between those two important steps in the theory of change.
I guess the big question here that I think we're trying to address is what's all of the members are doing things clearly to measure their own activities and the strength of the systems, but what's the value add that Agenda for Change, with its somewhat limited resources, can bring to this conversation? So I think if anybody has thoughts on that, chime in.
Two thoughts there, Susan. One, and be curious to see what Kate and Harold think about this. One, I certainly think if we could establish a clear link between a systems change approach and improved service delivery, that would be terrific. And I think that's what, if I understand, that's what the slide that's up is trying to do. And at the same time, and to a number of the, I think a number of the comments in the chat, what happens in between? It's the what happens in between that's hard, and should we be spending more time understanding that? So one of the questions I put in the chat is, can we do that and still not actually know what a functioning system looks like? And to me, it's not just about the systems, it's about the change part of the systems change. What are the factors that allow for a consistent improvement in a system? And do we know what that looks like? So those are not unrelated, but it is possible to do sort of a front to back analysis and say this leads to that without actually knowing what the steps are in between.
I think, Lewis, that's a good point to raise. And if you want to know what a fully functioning system can look like or should look like, I'd say that the proof is there in any country that delivers, nominal 100% coverage with 24/7, parameters. So we do know in a different socioeconomic context what a successful system looks like. Now, can you translate that back down and retrofit that? I think there's some questions there, but it's not like we don't know what a functioning system looks like. I think there is evidence there.
No, sorry, I wasn't clear enough on that. I guess what I'm looking for is that, some combination of sort of leading economic indicators, something that would indicate that you're moving in the, that would give you an indication that the dynamics of the system are moving in the right direction. And then to Vinny and what some of the other comments were in the chat is, do we have a way of measuring the stuff that's not the building blocks, that's the connections, that's the network changes, the networking, the relationships that I think are part of the answer to that question of how do you know if a system is dynamically moving in the right direction?
I think the answer to that one is for the latter, that there's quite limited experience, but Kate, you can maybe talk to the specifics of that. I mean, there were relatively few members looking at those aspects. Hence,
yeah, I mean, there were a few who did, both at baseline or at different points, were looking at some form of, I would say, right-sized political economy analysis, or really kind of power dynamics, and trying to understand, how decisions are made at different points in a WASH system, and the links between a national authority and a local authority. But yeah, that's the kind of type of factors, for lack of, we use the word function a lot, so I'm picking out my F's, but that's the types of, and arguably some of the more important ones, I think, in this system change stuff. I think when we de-actor or we depersonalize the factors, I think that actually does a bit of a disservice, because I think, factors don't just happen. They happen because actors do things, or groups of actors do things, and do things differently. So I think one of the pragmatic ways, maybe, Lewis, to think about it, what are some of the behaviors of actors that you want to see doing things differently towards that sort of vision state of a system, is a way that other sectors have felt comfort, if not confidence, that they were moving in the right direction.
That's exactly what I'm talking about, Kate. And I think to the extent we could develop some sort of guidance on if based on the little work that's been done in the wash sector, but certainly if there's learning from other sectors on how to do that, that would be terrific, because I think that would capture some of what a number of what I've always called the how, not just what, and it is some sort of the secret sauce in all of this. And the thing is, I think if you went in the discussions I have with folks in the districts, in the countries, they know when the thing's working and when it's not. What we haven't been able to do is to articulate that in a way that we can have a common conversation about it and we could measure it.
Yeah, no, it's true.
So there's a lot of intuitive knowledge there, but we have to figure out how to talk about it and to capture it.
Yeah. So Vinny and Ben, I think you both have had a few chats in here. Do one of you want to, Vinny, you want to join us and make any comments here for the group? Is he still on? How about Ben?
Hi. Yeah, I was just thinking is, and kind of also what we inputted as WaterAid into this process is that, and it also came up when we did the kind of webinar on the system strengthening approach that we've been using, is that distinction between what are we doing as WaterAid, and have the approaches that we've taken, trying to facilitate coordination, for example, had the desired effect, or have we been able to contribute towards a district having a stronger monitoring system? And at that level, it sounds like the approaches can't be the same for every organization, because you're tracking your intervention and you're tracking your intervention, and it needs to fit in with your existing monitoring and processes. But that area where you can, is this question of how strong is the system itself. That's the area where it does seem like you might be able to come up with a shared understanding, because at that point, we're not trying to say, what have we done as WaterAid? It's just how strong is the system? And then we can also then use that as an input into designing our program effectively, so that we try and kind of push on the right areas. So I think it's just understanding that the distinction between internal monitoring and then assessing the systems that we're working in and using that to inform our programming. So using that assessment of the system to identify, okay, well, these are therefore the things that we want to do as WaterAid. And therefore then as WaterAid, we tried X and Y to achieve that outcome that we wanted to achieve in the system. Did we achieve it or not, and why? So just those, I think we need to just understand those two different levels, I think, personally. And maybe that's where the added value of the collaboration comes in, is.
Thanks. And I don't know, maybe Vinny's not with us anymore on the call, at least. But Lamessa, you had a comment, I think, about government. Would you like to say more about that?
Thank you, Suzanne. It is like whatever we do at the end, we want to see the service level is improved. This is really what our local government partners are usually looking for. So yeah, that is what I've already put in the in the chat box. Of course, system strengthening could take time, but at the end, unless we get the service level improved, that is a bit disappointing, especially for our local government. Thank you.
Thank you. And then Govind, you had a question about who the target audience of this study report is. And I think that's a great question. If you're talking about phase 2, who is this for? Is this for the members? Is it for donors? Is it for the governments that you're working with? Somebody else? Any thoughts on that, Harold and Kate, or anyone else?
Susan, I think there's some obvious audiences, which is the membership itself, and I suppose most directly I'm reading between the lines, maybe not so much between the lines, that this is a good advocacy tool for influencing others, also getting more money. If you want to be brutally frank about it, there's a way of showing the donors, look, what we're doing does work. And yeah, to Lemessur's point, that at the end, if you don't see these improvements in service delivery, eventually people are going to say, well, we're doing single loop learning here. We should be trying to do something else completely, because this is not working. How long you wait for that, I don't know. But certainly, I think there's still time to show those links. So beyond those two broad audiences, I'm not sure. I think it would be useful for anybody that's interested in the whole approach of strengthening systems as a vehicle for achieving better outcomes.
Yeah, that's all I would add that point, Harold, just that we continue to, lots of different sectors are adopting, have adopted, continue to adopt, I would say, the kind of main principles of a systems approach. And I think there's often not enough learning between those sectors, so that, showing something in the wash could be of interest and value to those in, the financial services sector, those in solid waste or other different sectors. So yeah, quite a broad audience potentially.
Thanks. John Butterworth, you had a couple of comments you mentioned to us yesterday, and then you've made some chats here. Would you like to summarize or chime in here? I'm realizing some people might have dropped off because we've got a fewer participants now for the discussion. Anybody else we have one last minute or two for one more comment?
Susan, let me, Kate, it's Lewis again, just a really quick question here. This issue that plagues our sector of contribution versus attribution, of donors sort of driving each organization to demonstrate their impact, when what you really want is the collective impact and to know how you're contributing. Have you seen lessons learned from other sectors about how to deal with that particular issue?
Yeah, thanks, Lewis. I think the M&E community, and apologies if there's any M&E community who take offense at this, but they often fall into these false categories of being kind of contribution or attributionists. And I just find that really unhelpful. And I think I do see I think when you talk about attribution, what I see in other sectors is that's more around kind of additionality, value for money. So how do I know that X local government, X national government wouldn't have done this without the subsidy of aid? I think as you move up the chain in the theory of change, there's a much wider recognition that, at best, all you can hope for is contribution. I've seen some really neat kind of program or intervention-led contribution analysis, where an NGO themselves has said, right, X change happened, we're going to go and document and just look at what else might have caused this, present that to our donor, and kind of get on with it. I think it ends up being more of a negotiation between donors and implementers as to what is an acceptable, I guess, burden of proof, really, Lewis, kind of what can we know and what are we comfortable not knowing, I guess.
Yeah, I hear that. I mean, I think to what Ben was saying earlier, I think I understand why each organization wants to be able to measure what their own impact is, both to know whether they're doing a good job and to be able to demonstrate to their funders they are. But I think that has to be complemented with some sort of system-wide measurement to see if the whole thing is moving forward. And ideally, then one could sort of parcel out the kudos among the folks who are contributing to the system. And say, yes, we'll have a mutual pat on the back. We're all doing a good job because the whole thing's moving forward. I think you have to do both. If you just do it on an organization by organization basis, you're just not it's not collective action and you're not getting the picture.
Yeah, no, that's a really helpful way to describe it, Louis. What we've seen in other sectors is this move from what we call the microscope review, right? So really looking quite narrowly at what I've done and trying to link that up, and then almost the helicopter or the telescope view, which then zooms back out and says, okay, across the system, what does that look like? I mean, it's almost like going back and doing both your system assessment and your sort of intervention assessment much more regularly. So the guidance we're providing other programs is to do those both. So to, and this is internal, this isn't a massive study, as part of your annual reflection processes, whatever those look like, interrogate both how your own activities are leading to or not leading to the outcomes you expect, and also kind of what is happening in the wider system, because there may be something has changed that you then need to change your approach to, right? If a policy changes or if there's a different government, something like that. So yes, I'm just waffling on how much I agree with you, I think.
Kate and Louis, we're sorry to jump in. We've got to kind of wrap up here. I know this is very interesting. It sounds like we're going to be, there's still a lot of conversation that we need to have about what would be useful and how we move forward. And all of this is great. Thanks all of you for participating in this today. We really want to get more input too from the people working in these programs. So we're finding ways to do that. We have plans for some kind of conversations with the Members Country Program folks in January and ongoing. So thanks so much for all of you, and we'll probably be back with another round of suggested way forward and get more comments on that. So thanks to Kate and Harold for all the work. Thanks to all the members for sharing their data and all of the and their willingness to share. We know there are also some of you who want to learn from each other, so we will try to broker those conversations. We'll be asking if you are willing to have your name mentioned in the report or if you'd like to keep that private. So I would recommend, if you haven't read them already, please do go take a look at those reports. They're really interesting and there's some good charts in there. So thanks again, and I hope you all have a great day.